Recognizing Early Cancer Warning Signs, a life-saving guide. Did you know that 1 out of every 3 people will be diagnosed with cancer at some point in their lives? This is what the majority of people fail to notice. Every year, millions of cancer cases are identified too late because the early warning symptoms were not recognized. The American Cancer Society states that if cancer is detected in stage 1, the survival rates for many common types of cancer can exceed 90%. However, if you wait until stage 4, that likelihood can drop to below 20%. In only a few minutes, I will share with you 8 subtle warning signs that could actually save your life. Make sure you don't skip it, because the 7th one will surprise you. These symptoms are different from the ones that most people are familiar with. They are the subtle indications that your body sends out long before things become severe. Although the majority of individuals simply overlook these indicators, being able to recognize them could mean the difference between an early diagnosis and a late diagnosis. I can guess what you're thinking right now. Do all little aches and pains indicate that you have cancer? If you have ever searched for something on the internet, it may seem that way. That is precisely the reason this is not the same. We are looking at scientifically supported warning indicators, not unfounded stories that are spread on the internet. These are the exact indicators that have assisted thousands of people in detecting cancer at an early stage when therapies are most effective. Stay tuned, since this is not about instilling terror. It is about giving you the information that could help save lives. Let's get started. Persistent bone pain is one of the warning symptoms of possible malignancy that is most often ignored. Cancer-related bone pain is different from the brief soreness that you would experience after exercising or suffering a small injury. It usually gets worse with time and often becomes more severe at night. When cancer starts in the bones or spreads to them, it affects the normal structure of bone tissue. This causes a deep, penetrating aching that is difficult to ignore. Osteosarcoma, which is the primary kind of bone cancer, usually affects the long bones in the arms and legs. Initially, the pain may be mild, similar to a sprain or muscle strain, but it will progressively grow more intense and persistent. Some people say that it feels like a throbbing or painful sensation that does not go away with regular pain medication. It is important to get medical help right once if you have bone pain and also have swelling, increasing soreness, or unexplained fractures. Detecting bone cancer at an early stage can have a significant impact. Some kinds of changes to the skin can indicate that there is a more significant problem than just a mild discomfort. Leukemia is a type of cancer that affects blood-forming tissues. It can show up with unique skin symptoms that are commonly confused with less serious illnesses. The appearance and behavior of these rashes are the most important factors. Petechiae, which are little round patches on the skin that are produced by a lack of platelets, are a common symptom of leukemia. These spots are usually between 1 and 2 mm in size, and they do not turn white or fade when pushed. They can be red, purple, or brown, and they commonly show up in groups, particularly in locations that are under pressure, such as the ankles or under tight clothing. This is what is going on. Leukemia interferes with the generation of healthy platelets, which are necessary for stopping bleeding. When there are not enough platelets, little blood vessels called capillaries might leak, resulting in these distinctive spots. This is different from typical rashes, which may itch or go away after a few days. It is very important to see a doctor right away if you develop any of these symptoms. Detecting leukemia early can make a significant difference in how effectively it can be treated. If you are experiencing night sweats that are soaking your bedding and clothes, it could be due to more than simply a warm environment. If these episodes occur often and are not related to environmental circumstances or menopause, they could indicate the presence of an underlying illness, such as lymphoma. Night sweats that are associated to cancer frequently happen at the same time as other symptoms, such as fever and weight loss that cannot be explained. Oncologists are aware that these patterns are warning flags. Your body is fighting extra hard to fight cancer cells, which is why you are experiencing these extreme sweats. When the immune system responds to lymphoma, it releases inflammatory substances that interfere with the body's ability to regulate its temperature. It is common to experience occasional night sweats during times of stress or illness, but if you have recurrent drenching episodes, that is a warning sign that you should seek medical attention right away. When bilirubin accumulates in the body, jaundice occurs. This condition is characterized by yellowing of the skin and eyes. A quick onset in adults can be a warning sign of pancreatic or liver cancer. However, it can also be caused by a number of other things. In cases of pancreatic cancer, tumors can obstruct the bile duct, which stops bilirubin from being digested and eliminated from the body. As a result, bile enters the bloodstream, causing the skin and eyes to become yellow. If you experience any of the following symptoms, you should seek medical attention right away: upper abdominal pain, black urine, or light-colored feces. Subungual melanoma is an uncommon type of skin cancer that develops under the nails. It frequently starts out as a black streak that doesn't seem like anything serious. This vertical line on the nail, which is known medically as melanonychia striata, requires careful observation. This type of melanoma most often affects the thumb or big toe, although it can also arise on any other nail. Streaks that are broader than 3 mm, streaks that have uneven or different colors, and streaks that have fuzzy borders are all important warning indicators. If you spot any changes to your nails, especially dark streaks that are accompanied by discomfort, splitting, or bleeding, you should get medical attention right away. A fever that keeps coming back or that you can't explain could be your body's way of telling you that you have blood cancer. Cancer-related fevers are different from regular fevers in that they generally follow a certain pattern and come with systemic symptoms. Additionally, cancer-related fevers do not go away after a few days. Your immune system may release cytokines in response to blood malignancies such as leukemia and lymphoma, which can result in frequent fevers. Blood cancer fevers are characterized by a cyclical pattern, with temperature spikes occurring at regular intervals. A fever that lasts for more than 2 weeks or keeps coming back without a clear reason should be examined by a doctor. Blood malignancies can make your immune system weaker, which increases your risk of getting infections. In order to provide an accurate diagnosis, blood tests must be performed to look for aberrant cell counts. Additionally, keep in mind that early discovery can significantly improve outcomes. Your eyes can provide important information about your general health, including possible warning symptoms of cancer. Ocular melanoma is the most prevalent type of primary eye cancer in adults, even though it is rare. The signs of this condition sometimes begin subtly, but they can develop into more visible alterations that should never be disregarded. When cancer originates in the eye, it might create symptoms that are different from those of common eye problems. You may experience ongoing blurred vision that does not get better with new glasses or flashes of light that occur for no apparent reason and are not related to migraines. What is the most concerning indication? A dark patch on the iris that changes in size or color as time goes on. Ophthalmoscopes and other advanced imaging technologies enable doctors to take a close look at the inside anatomy of the eye. If you have light-colored eyes or fair skin, you are at a greater risk of getting ocular melanoma. You should not ignore persistent eye pain or unexpected changes in your eyesight. If you receive treatment early, it could save your vision and your life. If you have risk factors like a family history of eye cancer or prolonged exposure to the sun, it is extremely important to undergo regular eye checkups. It is essential to recognize these warning symptoms early in order to safeguard your health. Persistent heartburn and gastroesophageal reflux disease may appear to be a minor annoyance, but if they continue to occur despite changes in your lifestyle and medicine, they could indicate a more serious problem. Esophageal cancer is often indicated by persistent acid reflux that does not respond to treatment. The connection between chronic heartburn and cancer is that stomach acid repeatedly damages the lining of the esophagus. In addition to your heartburn, be on the lookout for symptoms such as difficulty swallowing, food getting stuck, or unexpected weight loss. If your heartburn has not improved after 3 weeks of taking over-the-counter drugs, you should see a healthcare expert. Even though these symptoms may not usually indicate cancer, they should nevertheless be evaluated by a medical professional. Thank you for tuning in. If you found this video useful, please give it a thumbs up and share it with others who might find it beneficial. Make sure to subscribe so you can receive more health-related information.